173% increase in newborns treated for withdrawal syndrome, for neonatal abstinence syndrome. So how do we actually do it? What happens with the babies, and how do we fix it? So there's a scoring system called the Finnegan scoring system. There are some other things, other methods that are used in different facilities, and other cutoff criteria that's used. So this is the one that I was the most familiar with and that I've seen in the vast majority of hospitals that I've worked in. But all of these criteria listed here on the left are the signs and symptoms that these babies will present with. And so they will rate them every 2 hours all day long, and they will give them, based on whether or not they have these items, they'll get these scores. And so they'll add up the scores and have the total score for that timing every 2 hours over the course of the day. And so we follow their scores, and basically we initiate medication therapy based on those scores. Usually the initial score to start medication for withdrawal is about 10. Some people started a little earlier, some people started a little later. These are a couple of quotes. One in particular was from Arnold Palmer Hospital, Winnie Palmer Hospital, which is where I used to work. There were 14,000 babies born per year at that hospital when I was there. And you know, the little song that they play overhead when babies are born, we never played that song because it would be playing all day long. And so we did. We saw these withdrawal babies there almost daily. A NICU nurse here said it's hard to watch them. You can't console them. Another NICU nurse said this one baby he couldn't even feed. He was screaming. His face was quivering so badly. And it is. It's very difficult to see these babies. They have convulsions. They have tremors. They have very high-pitched cries, stuffy sneezing, sweating, fever. They get really bad diaper rashes. They can have loose and watery stools. So it's definitely not a pretty picture.